Are you starting your nursing journey and feeling overwhelmed by all the medical jargon? Today, I'm going to run you through 25 common words or medical terminology that every new nurse or nursing student needs to know. These are terms you'll encounter in healthcare settings, and getting familiar with them before starting your placements or first job will help you feel more confident. These words cut across different wards and settings, whether you're in mental health, adult, or even children's nursing. They pop up in conversations with colleagues, during patient handovers, and in documentation. So stick around, because by the end of this video, you will have a solid foundation of nursing lingo to avoid feeling confused or like a total novice. Hello and welcome back to my channel. If you're new here, my name is Diana and I'm a public health professional currently specializing in mental health nursing. On this channel, I make videos about mental health awareness, general health and nursing topics, and provide insights for navigating the challenges of nursing school. If these topics are of interest to you, go on and hit the subscribe button and turn on the bell notification so that you get notified anytime I publish new videos. And to my returning subscribers, thank you so much for your love and support. All right, let's get started. The first word is DNA, DNAR, DNACPR. This stands for do not attempt resuscitation or do not attempt cardiopulmonary resuscitation. It's an important order in patient care signed by patients to ensure that resuscitation efforts are not attempted if their heart stops. For example, you might see it documented as DNAR in place. Always check for this in patient care plans or listen for it during handovers. The next word is SpO2. This is an abbreviation for saturation of peripheral oxygen, which refers to the percent saturation of oxygen in the blood. You'll see this often when using a pulse oximeter, and the normal range is between 95% to 100%. So, if a patient's SpO2 is below 95%, that might indicate they're not getting enough oxygen, except they have certain lung conditions like COPD, in which case their normal SpO2 range will be lower. The next word is prophylaxis. Prophylaxis means prevention. For example, post-exposure prophylaxis, which is a treatment taken after exposure to HIV to avoid getting infected. Another form of prophylaxis is giving a patient low-dose aspirin to prevent blood clots after surgery. The next word is auscultation. This is the act of listening to body sounds, usually with a stethoscope. For example, you might auscultate the lungs to check for abnormal breath sounds. The fifth word is covert. In healthcare, covert means hidden or disguised, often referring to administering medication in food or drink without the patient knowing. This must always be documented and agreed upon by a multidisciplinary team. The next word is PRN. This comes from the Latin phrase pro re nata, meaning as needed. PRN medications are administered on an as-needed basis. Examples include pain medication and medications for nausea, vomiting, indigestion, anxiety, or insomnia. The next word is PPE, personal protective equipment, like gloves, aprons, gowns, goggles, and masks. They are vital for infection control and for your own protection. The next word is seclusion. In mental health, seclusion refers to isolating a patient in a designated room to manage severe aggression or risk to others. This is used only as a last resort. The next word is dysphagia. This means difficulty swallowing food or liquid, which is common in stroke patients. Always ensure that you check the care plan of patients with dysphagia for any dietary modifications. The next word is Foley catheter. This is a tube inserted into the bladder to drain urine. It is thin, flexible, and sterile, and is also known as an indwelling urinary catheter. The next word is sputum. Sputum is mucus from the respiratory system that the body produces to protect the airways. It is often collected for testing, as changes in sputum color, thickness, or quantity may indicate a health problem, such as an infection, lung disease, or even cancer. The next word is thrombosis. Thrombosis is the formation of a blood clot inside a blood vessel. For example, a deep vein thrombosis, DVT, which commonly occurs in the legs. The next word is NPO or NBM. NPO stands for nil per os, which means nothing by mouth. And in the UK, it's referred to as NBM or nil by mouth. This is usually ordered before surgery or certain procedures. Quick break before we continue with the list. If you're finding this video helpful, why not consider joining my newly launched channel membership? As a member, you'll get access to exclusive perks like member shoutouts, early access to new videos, members-only live streams, and more personalized content. Click the join button to find out more. Your support means so much. Now, let's get back to the list. The 14th word on our list is low stim. Low stimulation environments are used in mental health settings to reduce sensory input or calm sensory overload for patients in distress. The next word on our list is NG tube. A nasogastric tube is a feeding tube inserted through the nose into the stomach, and it is often used for patients who can't eat orally. The next word is handover or report. This is simply the process of passing on patient information at shift changes. As a new nurse or nursing student, it is always important to listen carefully and take notes during handovers. The next word is exudate. This refers to fluid leaking from a wound, often due to inflammation or infection. For example, wounds with excessive exudate often need frequent dressing changes. The next word is weeping. Weeping wounds are those that continuously leak fluid, which can lead to skin breakdown if not properly managed. The next word is atrophy. Atrophy refers to the wasting away of muscles, often from disuse. For example, prolonged bed rest can lead to muscle atrophy. The 20th word on our list is a body map. This is a diagram that is used to document injuries or wounds on a patient, and it is often important in safeguarding cases. The next word is topical. Topical refers to medications applied directly to the skin, such as creams or ointments. For example, topical steroids might be prescribed for eczema. The next word is lethargy. Lethargy is extreme tiredness or a lack of energy. For example, a patient might report feeling lethargic due to an infection or dehydration. The next word is hypo or hyperglycemia. Hypoglycemia means low blood sugar. For example, a patient with diabetes might become shaky and dizzy if their blood sugar drops too low. Hyperglycemia, on the other hand, means high blood sugar, often seen in diabetic patients when their glucose level isn't well controlled. The next word is a stoma. A stoma is a surgically created opening, such as a colostomy, for waste to leave the body. You will learn a lot about stoma care in nursing school and also as a nurse. Last but not least is parenteral. Parenteral means administering medication or nutrition intravenously, bypassing the usual process of eating and digestion. And there you have it, 25 common words or phrases every new nurse or nursing student should know before stepping into any healthcare setting. I hope this video helps you feel more prepared and confident as you start your journey. If you found this video helpful, don't forget to like, share, and subscribe to my channel for more nursing tips and insights. And hey, let me know in the comments, which of these terms surprised you? Which would you like me to explain further? And what other common terms have you heard so that we can all learn? Thank you so much for watching, and I'll see you in the next video. Bye.